Hello, I'm Xavier, Caro, a rheumatologist here in Northridge, California, and this is the last of a brief series of videos that we've produced for our patients to better explain what they're going to be going through here at the center. If you're a visitor, otherwise, by all means, welcome. In this last video, what I'd like to do is to address some of the more common questions I get about fibromyalgia. In no particular order then, if you don't mind, I'll refer to my notes. The first question I noted was, how do I know if I have fibromyalgia? And a corollary of that question is, why don't more physicians help me with fibromyalgia or even recognize that I have it? So many of my patients tell me, I've gone from physician to physician and no one has diagnosed it, or if someone has, they haven't really helped me with it. And the reality behind all of that is that fibromyalgia is difficult for most physicians to understand because they haven't been trained in some of the immunology and some of the nervous system pathology that we've discussed in these videos. Secondly, there aren't a lot of markers in the bloodstream, the area most frequently tested by the average physician, to denote that someone is suffering from fibromyalgia, much less a systemic inflammatory disorder. These changes are fairly subtle, and while I like to say, perhaps a little bit chauvinistically, that rheumatologists are very well suited to discerning this inflammation, unfortunately, some of them even have trouble detecting some of the changes of fibromyalgia. Nevertheless, persevere, do some reading, and try your best to understand the components of fibromyalgia. As I've mentioned earlier, this disorder is made up of so many different complaints, it would be hard to enumerate them all. And I don't want to really bore you with all of them, but I will mention that many of my patients have, in addition to typical pain, fatigue, and cognitive problems, many of my patients complain of severe recurring headaches. If they have a tendency to migraine headaches, they are commonly made much worse by their fibromyalgia. Many of my patients complain of recurring abdominal pain, bloating, gassiness, and so on, which we believe is usually made up of irritable bowel syndrome plus the fibromyalgia symptoms themselves. Additionally, other patients will say, Dr. Caro, I hurt all over, but boy, do I really hurt. Then they point at some spot. And when that happens, nearly always there's something wrong at that spot. It could be an old injury. It might be an unrecognized musculoskeletal problem, perhaps a torn rotator cuff or another injury. We then will typically work on the fibromyalgia itself and then spend a lot of time trying to understand why that particular problem or that particular place troubles them so much. Second, our next question is to say, I often am asked, what is the role of exercise in fibromyalgia? I could spend a lot of time in any of these questions. Let me talk briefly about exercise. My typical patient tells me, Dr. Caro, if I don't exercise, I really feel bad from my fibromyalgia. I must move in order not to freeze up, not to feel stiff all day long. On the other hand, the same patient will say, Dr. Caro, if I exercise too much, I am wiped out for several days. Now, one problem with fibromyalgia and chronic fatigue is that this idea has gotten started and taken hold that these disorders are either brought out or made much worse by a lack of exercise. And there's a whole cadre of physicians who suggest or even demand The patients with these kinds of problems, again, fibromyalgia or chronic fatigue, exercise the heck out of themselves. Nothing could be worse for these patients. They will just be terribly ill from this. I must share with you, there's some scientific data to suggest that exercise is great in fibromyalgia and chronic fatigue, but most of us don't really buy into that, those particular observations. You know, in science, one observation is excellent. One scientific observation is excellent, but you really need to reproduce it several times before you can really take home that that is truth. Exercise is a very delicate, very powerful, and potentially a very harmful component of the environment for my fibromyalgia patients. So do be careful. Next, do I need narcotics? What kinds of powerful pain relievers do I need? And the answer is we essentially never start patients on narcotics here at the center. Unfortunately, a fair number of patients come to us already on narcotics. Because of our interest in the scientific aspects, the tissue aspects of fibromyalgia, we usually ask that these patients work with one of our local pain specialists who then will handle the narcotics and gradually decreasing the exposure to the narcotics. So you won't find us terribly enthusiastic about using narcotics, and since other, shall we say, newer treatments of pain with such things as medicinal marijuana and so on and so forth are in their infancy, we also do not really participate in any of that. Now, having said that, we have had a great experience using, on an emergent basis when necessary, intravenous, given into a vein, lidocaine. As lidocaine, as you know, is an anesthetic. Your dentist or your family doctor may use it to deaden an area that he's going to operate on or pull a tooth from, or just to kill local pain. But given intravenously and done in the right fashion, it's really quite safe. Intravenous lidocaine can be a tremendous pain reliever. And intriguingly, you would think, since after all you've used it with your dentist, it deadens the tooth for 4 hours. Well, Dr. Caro, that's not going to really be helpful the next day. Well, interestingly enough, it is. Investigations with lidocaine, even in animals, shows that after repeated treatments, even after one, but after repeated treatments in particular, the effect can be long-lasting. We're talking now probably multiples of hours to multiples of days. There are those who believe, and we don't use it quite as much to get this ourselves, but there are those who believe it can last weeks. And which is remarkable for a medication like this. But we do use it here in the center when we think we need it. Next, when and how will all of my symptoms improve? All I can say about this is that typically we find that the symptoms of fibromyalgia co-travel. By that we mean that if the pain is improved using, let us say, anti-inflammatories, necessary oral medications, intravenous medications such as IV, IG, that then other aspects of fibromyalgia will also improve, including the cognition, the fatigue, and ancillary symptoms. The fatigue is surely the most difficult of all the components to improve, but it also will get better, and we will at times then switch from treating the pain, which has diminished remarkably, to treating the fatigue in and of itself. And as I mentioned earlier in one of our videos, the fatigue problem is multifactorial. It may have components of sleep, depression, the pain. It may have components of inflammation, and so on. So it can be a subject in and of itself, perhaps a video in and of itself. Next, what's going to happen to me in the long run? Well, I can tell you that our experience suggests that we should be able to get your fibromyalgia markedly better. perhaps even completely under control. But you will be plagued by a tendency for recurrent fibromyalgia symptoms and problems probably throughout the rest of your life. We will advise you as to how you can protect yourself and whether you need to be followed up by a knowledgeable physician on a periodic basis. So those are the most common questions that came to mind before I shot this video. If you have other questions, however, we welcome you to send us an email at the address listed, and I wish you the very best in your fight against this scourge. Thank you.